the ABCs of MOTs, why it's here, who made it, why are we collecting this data, and what's this data being used for. My name is Kayla Camelli. I am the MOTS system administrator, and I'll be facilitating this meeting. It looks like we have a decent amount of folks here today, which is great. I love to see people in this session. So if you have questions as I go through or comments, things that you're curious about, we have a couple of our team members who I'll introduce shortly on this call who will be helping me monitor the chat. Feel free to raise your virtual hand if you have a question. I'm happy to answer them as I go. This is really a learning experience for everyone here. So if you have a question that you've been wondering about, chances are someone else in this call has the same question. So I really encourage you to ask it if you feel comfortable doing that. I did just click the recording button, which is a feat because I usually forget that part. But now that this will be recorded, I'll be able to put it on our YouTube channel or ask someone else to put it on our YouTube channel and then send out a link to this recording so that if you have someone else in your organization that will be responsible for this work, you can share this recording with them to get them, accustomed to why we're asking for this, what it's used for, and then a brief demo at the end of what our measures and outcomes tracking system looks like. So with that being said, I will move on. Next slide, which is this slide. We have a MOTS monthly webinar that we hold on the first Wednesday of every month that essentially goes over updates to the system. So this webinar that you're in right now is actually our introduction webinar that is relatively the same every month. So every month, new providers will come into the state, begin serving Oregonians, and need to report to MOTS. And we want to make sure that folks understand why we're asking for this data, how to submit the data, and who to go to if they have questions. So this is that webinar. If you mistakenly thought this was our updates webinar, no harm, no foul. You do not need to stay in this webinar if you are comfortable in the system and don't and know the background of why we collect the data and what the data is used for and all that. So I like to put that out there in the beginning in the event someone had a mistake happen or you're in here for the wrong day. We try to do Wednesdays as like a pattern, but I realize that can be confusing. So I want to make sure that is said up front. So if you're sticking around, thank you, and we will continue. As I mentioned, the purpose of this meeting is to meet our support team, discuss what types of data MOTS collects, what the data is used for, who's responsible for reporting the data, asking essentially which providers have that responsibility and where does it lie. Is it a state requirement? Is it a requirement through a contract? How providers can report data. I'll do a quick MOTS walkthrough, and then hopefully I'll be able to share some links as I go to documents that I find helpful for our users, which is the MOTS data dictionary, the MOTS reference manual are some that I have on my bookmarks that I use very frequently to help understand MOTS questions, because there are some areas of ambiguity within our system, and I find that the reference manual is a really helpful tool to kind of clear those ambiguities up. Don't see any questions as I am going here, so I will keep rolling. As I mentioned, my name is Kayla Camelli. I'm the MOTS system administrator. I always want to say that I am the Rhodes product owner as well, but folks might not know what Rhodes is if you are newly coming into the MOTS world. So Rhodes stands for the Resilience Outcomes Analysis and Data Submission System, which we are building at the state right now that will eventually take the place of MOTS next year. MOTS was built in 2013, and it's built on a framework called Cold Fusion that is no longer supported. We have one person at the state that supports that. I think it's a coding language. I'm not a technical genius, so I'm not sure. I may be getting that wrong. But anyways, there's not enough support for that type of system anymore, so we are building a new one. So if you just came into MOTS, I will be updating our MOTS communications lists with your emails that you provided so that you'll get updates with roads information as well. But I don't want anybody to worry about roads right now because we will give you ample time to prepare for that and have trainings and everything set up for you. So that transition will be hopefully seamless. I'm going to try my hardest to make it as seamless as possible. We have a number of MOTS team members who support this system and support our users, which is yourself. I'm not going to go through everybody's names, but we do have Mary here today. Mary, do you want to introduce yourself real quick?
Hello, everybody. My name's Mary Hurley, and I work along with Cecilia Lobby in monitoring the MOT support email and forwarding or answering your questions or forwarding your questions to others that may be able to answer them. So, been with the state for quite a while. In fact, I was here when before MOTS, we were the system was called CPMS, and it was paper that came into the state that we keyed in to the system. So there's been a lot of changes that has happened, and some good changes, and hopefully that will continue with roads.
Thank you, Mary. Yes, Mary is a vital resource for me in this world of MOTS. She has a lot of knowledge, and her and Cecilia do an amazing job monitoring the MOTS support email. And Mary and Cecilia really interface with our MOTS users the most, which is great because they're both so personable and so helpful. All right, so Mary and I will tag team the rest of this presentation. If you have questions, as I said, feel free to type them out in the text, raise your virtual hand, and I will hopefully see them and be able to answer them. So MOTS collects 3 types of data right now. We collect mental health and addictions data, mental health crisis data, and involuntary service data. So mental health and addictions data comes in 2 pieces, really. It's a status piece that gives us essentially status updates for a client and what they are receiving in terms of, well, how they are doing, like what their status is. Is their place of living changing? Is their diagnosis changing? Is anything about their frequency of use, if they're visiting your facility for substance use disorders, are those lessening? Are they getting worse? We just want to see if the services that are being provided are helping this client in recovery. So that happens in the status section. And then we, at a higher level, the reason that we collect status information is because we have another state system that is collecting Medicaid data. So if you're submitting data or submitting invoices to Medicaid or billing Medicaid for procedures, we'll be able to match up those procedures with the status updates to see if the procedures and what's being done is impacting that status. So these systems are really built to work together in that way. And that's why we also collect non-Medicaid service data. So in some cases, a client will have Medicaid, use Medicaid for a lot of the procedures or services they're receiving, but occasionally Medicaid doesn't cover a service that a client may need. And so that's where non-Medicaid service section comes in, so that we can get a full and holistic view of the services that a client is receiving, whether it's Medicaid or not, if they are utilizing any public funds for reporting. And we'll get further into who's reporting and what clients to report and all that stuff in a little bit. So that's our mental health and addictions. Mental health crises data comes into MOTS right now, and this is crisis services that are essentially subcontracted through counties, and Mary might have to help me out here. Is there any other way that you could be contracted to provide mental health crisis services, or is that a county CMHP level subcontract? Do you know?
Was that crisis you were asking about?
Yeah.
Uh, I don't know.
Okay.
So,
And typically providers will know if they are contracted with a public entity to provide that service. So it's not something, if you have a client that comes into your facility and you provide therapy and you have, counselors on your staff or clinical social workers on your staff, and someone comes in crisis, that is not the same as being contracted with the county to provide mental health crisis services. So if you have questions like that or need more distinction, just send us an email and let me know, and we can help figure out which area you need to be reporting in. And then also involuntary services, which are sometimes ordered by a judge, but typically providers will know if that's something that you're providing or the data that you're responsible to submit. I will move on here. What is this data used for? So I took off my little star, add it back. I like to put a star over the comply section of this slide because that is primarily our purpose for MOTS, is to comply with federal and state funding or grant requirements. So essentially, the state of Oregon receives funds through SAMHSA, which I had written down, the acronym written down that I no longer have. Anyway, Health and Human Services, mental health, substance use, federal programming funds our state. And in return for that funding, we have to send them what's called a TEDS report, which is treatment episode data set. So the federal government sends the state, which is us and our team, a list of fields that we have to collect from people that are utilizing public funds for those services. And we have to send that back to the government so that we can prove that those funds are being used appropriately. And that's the primary reason that MOTS exists. And that is the primary reason that our new road system will exist, is to fulfill this federal requirement. In addition to that federal requirement, there are contractual requirements that send providers to submit data into MOTS. And there's also grant requirements that push people into MOTS. And then there's also outside state policy, so ORS codes, or not codes, I think of them as codes. Essentially laws that have been enacted that say that if this client is receiving STD services or duty services, they are required to go into the system because this is a system that the state has identified that will collect that data to support that program, right? So it comes up with DUI services a lot, at least for me. I'm sure, Mary, you see it with other areas as well. But there's one law or one line in a policy that says if you're providing DUI services to a client, regardless of the funding type. So if it's a private pay or a public, coming from public funds, all of that needs to get put into MOTS so that we can track those DUI clients as a whole. So I like to highlight that is our primary reason for collecting this data, is so that we continue to get that funding from the federal government to provide services to Oregonians. Outside of that, the data is used to evaluate demographics so that we can see if certain geographical areas, certain populations are receiving or not receiving the care that they need. We look at client outcomes. So this is that status element that I mentioned before, is we are able to see chronologically someone's experience through treatment. This also helps with financial related activities, budget development, and rate setting. It allows us to evaluate how often contracts are getting utilized, because in MOTS, we do have an area where we are tracking if you're contracted with, Lake County for a service and you're identifying those connections in your data in MOTS, we can see that you're utilizing your Lake County contract more than you might be utilizing a Klamath County contract if you're on that border. out in Southern Oregon. We use it to support quality and utilization management activities, which is similar, like what is being utilized more, what's being utilized less. Is there something that we can do on our side to increase that utilization across the board so that we can get more services out to folks? I said I need to take that slide off because I already said evaluate, analyze health system transformation measures for performance and outcomes, which I believe is an acronym for some report that I have yet to learn a lot about. So that's on my list to learn more about. And lastly is respond to requests for information. I always like to caveat this, that the client data that providers and users are submitting into MOTs, if people are requesting information from MOTs, it is at an aggregate level, big numbers, percentages, it won't be individualized. So folks' data is secure. And I still see no questions, so I'm going to continue to move forward. Thanks for sticking with me. I will need a quick sip of water. This is the most I talk all day. Who reports to MOTs is a question that comes up a lot, obviously, because we work with people who think they're supposed to report to MOTs or got instructed to come or email MOT support and get registered with the MOT system. So this is a long slide, and unfortunately it has to be because this policy has kind of had a lot pushed under this umbrella. In general, if you are licensed with a letter of approval from HSD and receive public funds for services, those you should be reporting clients into MOTs. So those two things are our primary identifiers. In addition to that, there are also folks who should be reporting to MOTs that may not fit neatly in that one box. So that's providers with HSD contracts to deliver treatment services, subcontractors of CMHPs or CCOs that hold, where that entity holds a contract with HSD or OHA. So really we're following that trail of public funds, right? If the state is providing public funds to a CMHP or a community mental health provider, and the CMHP is subcontracting out those services, utilizing those funds, that's what we care about, right? We need to be able to prove that the public funds are being used in a way that is helping Oregonians. Providers that provide DUI services or opioid treatment services or opioid treatment providers, which is also called Medicaid assisted treatment for folks experiencing substance use disorders. So that is a caveat where we're not concerned about public funds. The legislature decided that in order to make sure that those services are being utilized, we need all of that data into MOTs. So regardless if a public fund was used for DUI services or opioid treatment provider or services, those data should be coming into the MOT system regardless. And then providers that contract with other governmental agencies to deliver mental health or substance abuse services. So if an agency is contracted with the Department of Corrections to provide behavioral health services, those providers, because they are a subcontractor of another state entity, those would also be required to report to MOTs. And because I've been talking about this slide for so long, it's totally understandable that people might get confused on whether or not they are supposed to be reporting into the system. So I get a lot of emails asking whether or not this specific provider should be reporting. And sometimes that could be a quick phone call if I can ask some questions and kind of help us along this flow chart really to see if somebody needs to provide services, or sometimes it's a quick email and a look on someone's website that can help. So if that's you and you're not sure or you have questions, just send us an email. I'll make sure to put our MOT support email in this chat if you don't have it. And I'll also link our website and some other things. And then once I'm able to get this slide and this recording, I'll put it both in an email. And at the end of the slide, we have some helpful links that you'll have access to as well, which are also available on our website. But I'm going to move on to submitting MOTS data. So right now in our current system, we have two methods to submit data. We have a electronic method, which utilizes an EHR or an EMR. And for those who don't know, an EHR is an electronic health record, and an EMR is an electronic medical record. We typically use them interchangeably. This is your Oceans, your Epics, your Dr. Clouds, and those are a couple names of EHRs that we're familiar with. And in order to utilize an EHR to submit MOTS data, it needs to be approved through our secure file transfer protocol. And our EHR needs to already have an established relationship, or the EHR, so the Oceans, the Epics, needs to already be connected to MOTS and have a configured file for that. So if you're curious if your EHR that you use is already configured for MOTS, send us an email and we can get you in touch with our EDI expert. Although I do have the list of approved EHRs right now that I use sometimes to answer questions quickly if she's busy. And if it is on that list, I think it would be an easy thing for the EHR to configure a file for your agency to send to MOTS and set this up. If it's not already in that list, it's kind of a bigger lift for an EHR to configure a file. And we typically will encourage folks to use our web portal if your EHR is not already on that list, because it can take months for an EHR to configure a file. Yes, I will share that list. I'll put that in the email I'm going to send to the group, because right now it's buried in my computer and there's no way I'm going to be able to find it by the time this is over, but I will absolutely get that to you. So EHR or EDI is what we call that method. So electronic data interchange utilizes the SFTP service. Our other option to submit data is using our client entry option, which is the web portal, which I will demo here in a minute. And this allows organizations to manually enter data. So this is, if you have a client, you have your client submits paperwork, and then you just copy that demographic information, some procedure codes, some diagnosis codes into MOTS. And then you can update that as you go in the web portal. And I get this question a lot, and I can actually, I've included some more detailed information on reporting requirements in the last issue of our newsletter and in our last webinar, so I need to update this slide as well. Client submissions need to happen at least within 7 days of admission if a client is receiving services at your organization, and then updates every 90 days. And this is so we can get those recurring snapshots of a person's experience in treatment. So we can really see that chronological wave that I was talking about. Without recurring updates, that becomes really difficult to see what is impacting what and if there is correlations anywhere. We recently, there was an administrative pause that happened during COVID that kind of put a pause on most of our reporting requirements. But that pause is being lifted in October. So I will put that information in that email as well in the event you don't get our weekly or our monthly newsletter. So you can kind of keep up to date with what's going on. Some providers opted to not follow that guidance with delaying the amount or lessening the amount of data they're providing. If you're already providing this data on this cycle and it doesn't impact your ability to provide services, we encourage folks to continue providing those 90-day updates. So I will move on here and get into this demo. So this is our MOTS training portal. So this data in here, if you see data, you see me adding data that is not real, that's okay because we are in a testing environment. So none of this data should be used for is accurate or real. There's a lot of Bugs Bunnies. There's a lot. There might be a Harry Potter in here, and we just use this to kind of show people how to use the system. So the first page, when you log into MOTS, this will be a P number up here in this right-hand corner. And that will be your username for the MOTS system. If you don't have a P number, I will put that in the email as well. I'm going to make this email. It's just going to be chock full of good information. But our team can help you get set up with a P number. P numbers are individual identification numbers, so it can't be shared within an organization because we need to be able to audit who's accessing which documents or which data. In the event that we are audited, we need to be able to see, like, if something were to happen, if someone were to go in a system and delete all the clients or delete a bunch of records, we need to be able to know who that was. So this isn't a number that can be shared. So if you have folks at your agency that have one and somebody new needs one, don't share that number because that's connected to your name. Reach out to us and we will, process the information and give that new person an individualized number so that they don't get, pushed under someone else's umbrella. So we really don't use this message feature, so you won't see any messages here from us. But you can change the color background of your MOTS. So there's a lot of different options. We're very dark. The only one that I advise against is the red one. Because our system utilizes the color red to signify an error or something that an individual will need to fix before they're able to submit something. It'd be hard to see it if your background is red. So that's the only one that I suggest change or not using because of that. Everything else is pretty good. Some of them have real Windows 95 energy. We'll go to the base. That's a nice one. So for our client entry folks, this is what your screen will look like. You'll have a client lookup. That's typically where you start to submit data. You'll see your agency here. So right now I am student 1. I'm signed in as student 1. And so I am a worker of a Magnificent Healer agency. And at my agency, we have 2 facilities. We have one in Portland and one in Harney County, maybe. So I will select the one that my client is in. In some cases, whomever is assigning or telling us that they need new P numbers for employees will let us know if that employee should have access at the agency level or if that employee should only have access to one facility. Sometimes the agency and the facility are the same because there's just one place this thing is happening. So if if I started a counseling service and I rent out a space in Portland, I would be an agency and I would also be a facility because it's just my one space. But 5 years later, maybe I hire on a couple people, I get another space in Washington County. And so now I would be an agency because I had one facility, but now I'm an agency and I have 2 facilities. And that's just how that works. That helps us when there's the larger organizations that their admin information might be different than their physical locations on the ground. Or not on the ground now because we have a lot of telehealth work happening. So, but anyway, the facility is here. You'll typically only see the one that you're supposed to see. So if you have access to more than one, you'll see the ones in your agency. If you are only responsible for submitting data for one facility, you'll only see the one. So, and it may auto-populate if there's only one, like it did for my agency here. So let's see if there is a Harry Potter in here already. There is a Harry Potter in there. And it looks like they are active. So we can do there's a McDonald in here. We can do a Ronald McDonald. So first I'm going to search for my client. Ronald McDonald came in for treatment, and it's been a few days since they had their first session with one of our clinicians. So we need to put him into the MOTs system. So I search for his name, not coming up. So we will add a new client. When you add a new client, you'll get to this screen, which looks pretty empty. Typically, most folks will be needing to add a treatment episode. If you are also an agency that conducts mental health crisis or involuntary services, those will be there. So you'll be able to click that as well. But if you are doing behavioral health service or behavioral health or SUD services or substance use disorder services, you'll need to start here with a new TX episode, which stands for treatment. So I'll click the new treatment status episode. And you'll notice that all of these are grayed out, all these boxes. And that's because I have not specified which facility that this person is at. So once I specify which facility that Ronald McDonald is receiving treatment, these fields will become editable. And so I can continue with my client entry here. So Ronald. I don't know if Ronald has middle name. Don't know his date of birth, but maybe it's 1941. That sounds good. For client treatment status here, you have two options. You'll have active or assessment only. So if you select that your client is active, that means they are coming back and they will be a regular client at your facility. In some instances, someone will come in and have a initial session with a provider and realize that maybe the type of care that they're seeking your facility doesn't provide, or you don't have a provider on your staff that's able to fulfill a request from a client. Whatever the reason is, sometimes just an assessment is done and that person doesn't come back. So in that case, we have an assessment only status, so that we only need this little bit of information on that person and not anything else. But if this client comes back and if they are a client receiving services, then it will be active and it opens up these two tabs up here. So a client ID, this field is a identification number that is specific to your facility. So it's not a number that we have, it's a number that the facility keeps. And this number, we ask that it doesn't contain any identified information. It can be a random combination of numbers and letters. It's really a way that we can ask a question about an individual without using any of their personal identification information to ask that question. So if I say, hey, is client 145TG, if I have a question about that treatment episode, I don't have to communicate any, identifying information. And that's really why we ask for that, so that we can use it to communicate. So if Ronald McDonald, maybe this is 95 LA would be one. And then we'll get to this Medicaid number. So this is a situational field, which means that depending on what you select for some other values in these different sections, if you say that they're using Medicaid or OHP, this box will say that we need that the system will recognize that, like, hey, you said that they're using Medicaid, but you didn't give us a Medicaid ID. That's when it becomes necessary. If we leave this blank and we don't ever mention that this person is using Medicaid to pay for services, we don't need to fill it out. So we'll leave it blank for now. This race field is a mover box, so you select the things you want and you pull them back if you do not want them. I do not know Ronald McDonald's ethnicity. I also don't know his marital status. I don't know if he's a veteran. This competitive employment is also a mover box. So same thing, look it over if you don't want it there. Maybe he works for McDonald's part-time. I'm not really sure. I'm learning a lot about Ronald McDonald in this moment. Or I'm learning how much I don't know about Ronald McDonald. This living arrangement field basically gives us a snapshot of where this person is living. So a residential facility, a private residence, he lives at home. This date living arrangement change field is helpful in our status updates if that value were to change. So let's say you're seeing Ronald McDonald for 6 months and he started off in a residential treatment facility. And 6 months later, he moves out of that residential treatment facility into a house with a relative, a house with a cousin or a child. This is assuming that Ronald McDonald has an adult child that's helping. That would change, and then you would utilize this date living arrangement change field to let us know when that change happened. And I see a hand, so I will answer a question. I can't see who's asking.
Hi.
But
Hi,
hello.
Kayla. Yeah, so I think you might have just covered it, but we work with youth at my agency, and I've always had a kind of question about the living arrangement thing, what terminology to use. And when you do the drop-down menu, there's those choices, and I was just wondering, like, in most cases, it's the young person is living with the parent, so that's private residence with relative, right?
Yeah.
Okay, because there was a tendency to hit private residence at home, but that's different. I'm assuming private residence at home is when it's more usually an adult situation where they're paying their own rent or mortgage versus, a youth living with a relative.
Yeah, and I think it's hard because MOTS is collecting both youth and adult data, sometimes the values aren't as clear as they need to be, right? Specifically for a situation like that. And if those questions come up, because that's a great question, I even need to go to the MOTS reference manual, because sometimes the MOTS reference manual will identify those situations and tell you which option is the best, or which option that we would guide someone. So these are, so if you use the MOTS reference manual, I typically use the find function, type in, an identifying word of the field I'm trying to find. And then we have the options. So let's see what it says for private residence with a relative. Okay, non-parental adult relative in a private residence. Well, we learned something here. I don't have time to read through this all right now, but I will go back and read to figure out which the best option to be reporting. Because I'm pretty sure this is for a lot of these fields, like I mentioned, it's a federal guideline. So we are pulling how the federal government wants to parse out this information, which might be different than how I might want that information parsed out. So let me read through this, and I'm going to put this actually in the chat right now so that folks can explore, because it does have a lot of very useful information. So can you repeat your name? Who asked that question? So I know who I can get back to.
Yeah, so my name's Terrence Kennedy. I'm with Northwest Family Services. You did answer my question though, because I was unaware about the MOTS manual and I will be utilizing that. So thank you for demonstrating that too.
Oh, great. Okay. Well, thank you, Terrence, for your question. And I'll be sure to look at that because I'm also curious about that now too. All right. So living arrangement. There's a lot of options, and if, as we just learned right now, if this option feels like you need more context, the reference manual does provide that context, right? So it gives us a sentence or two sentences about each option, because we obviously cannot put that in this drop-down menu or it would be too long. So we'll say that Ronald McDonald is at home. This is the county of residence. So where does Ronald McDonald live? We'll say he lives in Clackamas County. And this county of responsibility sometimes is tricky, and it really applies to those facilities that either have a more mobile client base. So if you're in the Multnomah County, Washington County, Clackamas County metro area, you might have somebody that lives in Multnomah County but is receiving services in Clackamas County. And we want to know that so we know which public funds, so which county's public funds are being used to treat which clients. Because if we see the numbers coming from Clackamas County, we don't want to assume that all of Clackamas County's funding numbers are being spent on Clackamas County residents, because that may not be true, right? That may be giving us a number. But we want to know where the client is coming from and who is serving the client to identify gaps. So if there's areas where no services exist and folks are coming in to another county to get services, that's valuable information for us to be able to identify those gaps in those areas where maybe more services should be pushed, or we should communicate that with the state as a whole to see if there's ways that we can identify and fill those gaps. So that is our client profile. If Ronald McDonald comes into our facility and starts receiving behavioral health services, then he will need an admission date. So we will say that he came in last Thursday as an admission date. We'll give Ronald's zip code. Did I put it in Clackamas? I don't know any zip codes for Clackamas County, actually. So we're going to do a Portland zip code. And state of residence is at the top. That's Oregon. Occasionally you'll have, if your organization is on the border of Idaho or the border of California, border of Washington, you might have folks from different states coming to receive services, and that's fine, right? We just want to know the residential location of these clients. Estimated gross monthly household income is a field that we ask for, and this is also one that I typically use our reference manual for, because it is a complicated one. There we go. Gross. I forgot the word gross. Okay, so this is a numeric field. If you look back, it's going to ask us for a number. So in the event the client does not want to share the information, we should enter a 1. If the number is 0, we assume that there is no household income for this client. So situations like this, where you might have a client that declines to answer a question, the reference manual will help to give you guidance on how you should communicate that in the MOTS system, right? Because we don't have a checkbox next to every field that says declines to answer or doesn't know. But a lot of times that guidance will be in the reference manual. So let's say that Ronald McDonald refuses to answer that question. So I'm going to put a 1. And that will communicate to our staff, if anyone's running reports, that if there is a 1 in the estimated gross monthly household income value, that person did not want to answer that question, it doesn't mean that they make $1 a month. So the source of income and support, we'll say, I think he is, he works part-time for McDonald's, so he is receiving wages. And this is the expected or actual source of payment for treatment. So there's workers' compensation, self-pay, private health insurance, Medicare, OHP, county financial assistance agreement, other government payments, non-Medicaid. I think that would cover grants. If the government gave you a grant, it's not Medicaid, but it is for health services. So we'll say he's on Medicaid or OHP. Ronald doesn't have any child dependents. And you'll notice that I moved to the number of child dependents before I go to the total number of dependents. For example, if Ronald McDonald had 2 kids that were the child dependents, the total number of dependents would be 3, because it would be Ronald McDonald and the 2 child dependents. So I like to do that math that way versus the hope. It just makes more sense to my brain to do it that way. But if it works for you and you can go straight to total number to number of children, more power to you. Primary health insurance, we're going to go to Medicare and Medicaid and OHP. All of these fields are also the mover boxes like we talked about earlier. We ask, were they referred from anywhere specific to your organization? This helps us see those communication networks and how they're happening. So if it was, a community housing person that, was helping Ronald McDonald with his house or trying to get into a bigger house or a different house. And they were like, hey, you should go here for services. And that's where you came from. We want to know that so that we can see those connections and see which ones are being utilized most frequently. And this referred to. So if Ronald McDonald came to your facility, he's receiving behavioral health services from your staff. But maybe he mentions that he's having trouble providing, nutrition for his family, or his family is having trouble with a youth in their household that might need some assistance. So we can say that we refer them to TANF, which stands for Temporary Assistance for Needy Families. And that acronym should be in the reference manual. So if you're not sure about some of these referred tos, because I know there's so many acronyms being used at the state level, and there is no judgment if you don't know those acronyms, because I've worked for the state for over a year now, and I don't know a lot of the acronyms. I really wish we would just move away from acronym soup all the time, but that's not the world that we live in. So if there is so we'll say that Ronald McDonald was referred to food stamps or TANF. We ask for tribal affiliation. So if Ronald McDonald affiliated with any of the Oregon tribes, we'd want to know that. If he doesn't, we will say not applicable. This interpreter field is one that doesn't get utilized very much. And it will be going away in our new system because we have more efficient means of asking this question. But for the meantime, we ask if it was a foreign language or if this person was hearing impaired and you needed an interpreter to provide services. If not, you can put none. Is the client pregnant? Go ahead, Mary.
On the interpreter, the question that you need to ask if you use a foreign language is if you had to hire somebody outside your facility to provide interpretation services. Is that the way to say that? Mm-hmm. So if you have somebody on your staff that speaks Spanish, then you would put none for interpreter, but it's if you had to hire somebody outside of your company to provide that service.
Yes, it's a really good distinction. Thank you, Mary. And this question, this question will be helpful in our new system. Right now, it doesn't really tell us a lot, right? Like if you had to hire a translation service for a session, it doesn't tell us which language that was used. Like it doesn't give us a lot of information. In our new system, we have a number of fields that are specific to ensuring that services that are being provided are equally accessible for so many people, right? And so just know that this field is collecting an important piece of information, but the system that will be replacing MOTs will be providing a more detailed experience for this in the future, so that we can really make sure that we're doing a good job for making sure services are accessible for as many people as who need them. This high school grade completed is a number value. So if Ronald McDonald graduated high school, it would be 12. If Ronald McDonald graduated and has a Bachelor of Arts or a Bachelor's of Science degree, it would be 16. And that list, if you need help figuring it out, is also in the reference manual. If you're like, I'm not sure if Ronald McDonald finished 6th grade. If he finished 6th grade, we'd put 6 because that would be the highest grade completed, right? Tobacco use for Ronald McDonald is a yes, no, or unknown. We'll say no. Substance use in the last 90 days. And this last 90 days happens because updates are supposed to be happening every 90 days, right? So we'd be able to provide that snapshot as we go. There's a couple of legal status fields. These are all detailed in the reference manual. If they all look confusing to you and you don't recognize these terms, it's likely that you will not have to use them, right? Folks that are working with Dewey clients, this all looks familiar to them. And so those options make sense. If you're not working with anybody who is is receiving services based on geodiversion, you don't have to worry about these. You can put none or unknown if you don't know. Same with these number of rests in the past month. These are all situational and will depend. If you put none here, none of these are going to be necessary because that's not your population that you're working with while you're filling out this piece of information. But if I clicked jail, Dewey convicted, I might end up having to submit these because this value means that my client may have been arrested or may have been in the judicial system this month or in the past, and I would want to know those things. Similarly with this field, which is the Oregon driver's license number or Oregon ID number. If you have a Dewey client, we'll need to know that, but if you don't have a Dewey client, then we do not need to know that. And I am running out of time. I really always wish that I was faster at this. But I'm not going to go through the rest of the fields because I want to make sure that I give folks time for questions. This was the behavioral health detail. I did not go into the addictions detail, but if you are providing addiction services, this is what that tab looks like. It's not very extensive. We'll have a primary, a secondary, and a tertiary substance, age at first use, frequency of use, and the usual route of administration. And then a couple of questions. Obviously, this Dewey completion date, if your client is not there for Dewey services, not applicable there. And then lastly, this child in residential treatment with parents. If that child is in a residential treatment facility while their parents are getting services in that residential treatment facility, that's the child's date of birth that should go in there, just so we know how old this child is in with their parent. So I will pop back over to our PowerPoint really quick. And I will move these, I will add these links to that email that I said I was going to send, which will give a reference manual link, which I did put in this chat, our website, our user guide, which is also helpful. It kind of walks you through the screens and lets you know screen by screen what we're expecting. And then also there's a couple tip sheets. So if you work with youth or if you work with folks that are receiving duty services, we have like specific sheets that are helpful for you to better understand what we're asking for, or an order we recommend that makes it easier. They're just like helpful things from the MOTS team that works with this data a lot that could possibly help you be more efficient in your MOTS data submissions, which I know is a big topic because we want to make sure that providers are also having time to or have capacity to provide the most care. And this is our question page. So we have like 3 minutes left. I want to make sure I am mindful of everybody's time and let you out on time here. We have our MOTS support email, which is hard to see when it is hyperlinked. But I will move here. I'm just going to put this in the chat so that folks have it and can access it. Is there any questions? If I did not go over something, or if your organization does involuntary services or crisis services and you want me to go through that, shoot me an email and I'm happy to set up a time with you so that you can see the system and maybe get accustomed to what it looks like and what we are asking you for, because I definitely don't want people feeling unprepared to go into the system and submit data if you have questions. So if your organization is submitting data that I didn't review, or you want to go over it again, just let me know and I'm happy to do that. We have a lot of really knowledgeable people on our team that are able to provide a lot of detail and description for things. Many of them have much better ability than I do to provide that. I do my best, but there's people that have worked with MOTS since its inception 10 years ago that are very well versed on the system and are always happy to help providers. So with that, and I don't see any questions in the chat, or besides the list, which I will add to the email, I don't see any hands raised. So with that exit, I think I can let folks go. Thank you so much for joining our webinar. I hope it was helpful. I'm always interested in getting feedback. If you think that I spent too much time talking about one thing and not enough time on a demo, I want to know those things because I want to make sure that this hour is valuable to folks and you're taking away what we hoped you would be taking away. So if you want to provide feedback or let me know if there was something I didn't talk about that you wish was included, I welcome it. If not, I appreciate you being here. Have a great rest of your day and we'll talk to you all soon. Bye.